All right, let's kick things off. Good morning, good day. My name is Kemi Alesami, and I'm the Executive Director of the Laundromat Project. I use she, her pronouns. I'm a Black woman with shoulder length dreadlocks and white framed glasses, and I'm sitting in front of a bookcase wearing a purple and Black Adire tie-dye dress from West Africa. For those of you who are new to our community, the Laundromat Project is a Black-rooted, people of color-centered arts organization working at the intersection of arts, social justice, and community building. Since 2005, the LP, as we call ourselves often, has advanced artists and neighbors as change agents in their own communities. Thank you today for joining us for part two of our part two of 5 of our two-day public program, Abolitionist Storywork, Weaving Collective Narratives of Freedom. For those of you who were able to join us last night for the opening kitchen table conversation, you know how amazing today will be. I hope you can join us for even more of the sessions throughout the day. And if not, there will be video. This morning, we are presenting COVID and Confinement, Archiving the Pandemic in Prisons and Jails. This, you are looking at an image. The visual image is a satellite aerial photograph showing Rikers Island from above. And there's also black and white text with the title of the program and the names of participants who I'll be introducing shortly. We'd like to begin the program by sharing a few access notes. The Laundromat Project is committed to hosting accessible and inclusive events. Real-time captioning is available for this program. You can turn captions on or off through the closed captions tab located on the features bar at the bottom of this screen. We'll be recording today's sessions for archival purposes. The recording may also be available on YouTube after the event. If you do not wish to appear on the recording, you can turn your camera off, not really a big thing for a webinar. Your mics will be turned off for the duration of the program, presentations, and conversations. We also begin each of our programs, public programs at the Laundromat Project with a land acknowledgement. We at the Laundromat Project respectfully acknowledge that our primary location of operations at 1476 Fulton Street in Brooklyn, New York, sits on the occupied and unceded lands of the Canarsie, who are part of the Munsee Lenape. We recognize them as the original stewards of this land and pay respect to their elders, past, present, and future. I invite you to join us in acknowledging the histories of the land where you are currently gathered and to pay respects and gratitude to its original stewards as well. And now for the program. COVID and Confinement, Archiving the Pandemic in Prisons and Jails is presented in collaboration with our inaugural Radical Imagination Fellow, Piper Anderson. The fellowship is designed to engage the LP staff, board, and larger LP community around new ideas and perspectives. The fellow's role was conceived to deepen our understanding around timely issues of abolition, healing, justice, public memory, and the Black radical imagination. It is within this context that today's program came to be with Piper as our inaugural Radical Imagination Fellow. Piper, for those of you who do not know, has been working with us for 9 months and leading sessions with our community and has organized this series of timely and urgent programs. She has been involved in abolitionist and storytelling work for a very long time. We are grateful to be in community with her and excited to share these conversations with you. Transforming narratives of punishment demands a reckoning with the past while keeping our feet planted in the direction of the future that we want to create. Abolitionist story workers use narrative strategies to reflect on our shared experience of criminal punishment and state violence as a starting place for building a shared vision for a world free of systems of punishment. In this 2-day convening, which is through this afternoon, we hope you will learn, imagine, dream, and weave stories of abolition alongside practitioners working in oral history, community archive development, and an interdisciplinary range of narrative justice strategies to create community care, safety, and liberation. For today, we are joined by Regina Campbell from the Rikers Public Memory Project and Murphy Carter from the Texas After Violence and Sheltering Justice. You can access everyone's bio via the chat. There will be a link in the chat shortly. And now, thank you so much, Piper, Regina, and Murphy. And I'm so excited to turn this over to you, Regina, so that we can learn even more. Welcome.
Thank you, Kemi. We appreciate this opportunity this morning to talk about COVID and confinement and archiving the pandemics in prisons and jails. My name is Regina Campbell, and I've been the project manager for the Rikers Public Memory Project for the last 2 years. And co-facilitating with me is Murphy and Carter from the Texas After Violence program. So I want to start out just giving you a brief summary of what we're going to be talking about today. We're going to share some lessons learned from our respective projects. You'll have an opportunity to hear some narratives from each of our archives. And Murphy and I are going to spend some time talking about the ways the pandemic have further revealed how deeply entrenched health inequities are in the system of confinement. And we realize these topics extend far beyond the hour that we have together. Both the topics of COVID and confinement and archiving oral histories are expansive, and these are subjects that Murphy and I are passionate about. But we are going to try our best to just give you a slice of both topics and are more than willing to continue the conversation after our session today. So here we see a picture of one of our narrators, Dwayne Gardner, who is sitting in a hotel room and on a Zoom screen, and he's going to share his narrative. He was at the Mercy, he was incarcerated at Rikers during the COVID pandemic when it first hit in early 2020, and he's from Brooklyn, New York.
It was so terrible, and especially with the COVID-19, where they didn't care about us. They didn't care if we died right here. They ain't gave us no gloves, no masks. They wasn't telling us nothing. They stopped putting the newspaper out. There was so much misinformation going on. See, I'm a diabetic. I was in there with the first case, with the guy with the first case of COVID-19. And we're in the same infirmary that he's in. And we don't have no masks on or no gloves. It took them 4 weeks when the pandemic was at the top for them to try to give us masks that they want us to sign for. We all could have had it by now. It's too late for that. Now y'all want to cover yourself. But then you got officers wearing masks that they bought. How can you be a facility, right? And you wasn't prepared for this. You're supposed to be prepared for this. We're supposed to have had numerous masks, numerous sanitizers. Still ain't get sanitizer for the units. Still, it wasn't no, even when I left, wasn't no sanitizer for the units. And there's no way it's social distancing. Then I got to work the mess hall. I got to deliver your food. So how is it social distancing? I got to come to this housing unit, drop the food off at that housing unit. How is it this? They did it totally wrong. Then you see the same officers, like they don't even go home. They were stuck there too. They had a crew of officers that you see all the time before you see numerous different officers, but everybody wasn't coming to work. Then we find out you got 300, 400 officers from the building that's sick So they stopped the visits. So it can't be our visitors bringing it in, it's the officers bringing it in. But y'all not giving us no information. We wasn't getting no information. Now we stuck. We wasn't going to the yard. We're stuck in a unit. So when you stuck in a unit like that with nobody telling you nothing, everybody pressures at a boiling point, what's gonna happen? Violence. And that started happening. People fighting each other. And they can't move you out the building because other buildings ain't accepting you. So, you know, it was so much chaos. You're dealing with so many different personalities of anger. It's not a good look. That's why I say, I'm never going back. I'm getting my life together. So far, so good. I'm on the right track. It was so terrible in there, especially with.
So that was one of our narrators, Dwayne Gardner. And so just to provide context about where Rikers Island is, we see here an aerial photo of an island in the East River between Queens and Bronx, New York. And on the photo, there's a cluster of buildings, which is a jail complex isolated from the rest of the city, a forgotten island. And its impact reaches much farther than the East River. Rikers Island is the world's largest penal colony with 413 acres that can accommodate up to 15,000 people and an annual budget of $160 million. And it's the last historical penal colony in the United States. But interesting enough, it's not a prison. It's a series of jails. It houses people, men, women, juveniles, people with mental health issues, awaiting trial, should be presumed innocent. All right. And the history of Rikers has never been published or been a part of the public record, even though it's central to New York City's history. But it does exist in the collective memories of those who have endured the trauma of Rikers. And it's that memory that the Rikers Public Memory Project seeks to activate. Here we have a timeline of some historical health inequities at Rikers Island, and I'm not going to spend much time on here, but it's just worth noting that even before Rikers Island became a correctional facility, people placed those that they didn't want on this forgotten island. And Rikers has a history of disappearing people from cities' communities. Interesting, in 1882, when New York actually purchased Rikers Island, they used it to incarcerate or quarantine people with diseases like leprosy and TB. And this practice continued through the 50s and the 60s. And in the 90s, there was a record-breaking TB outbreak that affected the jails. And studies show that for every person that entered Rikers, they were 2 times more likely to contract TB. And one of our narrators, Natasha White, she shared her own personal story, how everyone in her unit had tested positive for TB at one point. And that outbreak parallels what we see with the COVID pandemic right now. Nothing has changed. Just this week, as I was preparing for this presentation, medical staff reported that 30% of inmates in Rikers urgent care unit who tested negative upon entry ended up testing positive after the COVID, the crowded intake process that they went through. And the rates of the COVID cases inside the correctional facilities reveal the gaps in healthcare and the lack of political urgency to protect the health of those incarcerated. We heard from narrators who were at Rikers Island during the COVID pandemic, how they were forced to sleep in cramped cells with people that had tested positive for COVID, and how the facilities were not suited for combating infectious disease. Here's a few stats that have been reported by the Correctional Health Services, but it's worth noting that throughout the pandemic, prison systems have used disparate methods to publicly report deaths connected to COVID-19. Even in collecting these numbers, I found that staff The reporting numbers for staff were based on cumulative numbers, but daily reporting only for those that were incarcerated. So really the known toll on incarcerated people falls far short from providing a full picture of what's happening in correctional facilities. So I'm going to shift a little bit and talk to you about the Rikers Public Project, right? And our effort to harness public memory. Our project was founded in 2018, and after a year of listening to and building relationships with communities and those directly impacted, 3 projects emerged: an oral history project, mobile museum, and a public health initiative. Communities stressed that they wanted their stories of survival to be used for education and justice. So we're working to ensure that Rikers is not forgotten and its memory is shaped by those who were detained there and their families and their communities. And we're working to build public support for ensuring that New York City and the mayor fulfills their pledge to close Rikers Island by 2027 and reinvest in directly impacted communities across the city. So we're using storytelling, art making, and the collected oral histories to ensure that the stories of those who have suffered because of Rikers are preserved. And I want to take a moment to mention that all of the illustrations in this presentation are inspired by oral histories, and they were made by one of our college interns, Davija Bentoncourt, as part of our video series. And this particular illustration depicts a woman of color gripping jailhouse bars. So our work is centered around 3 main areas: remember, repair, and redress. We want to remember by bringing Rikers to those who may not understand its impact. We want to engage New Yorkers in holding city officials accountable for their commitment to close Rikers, and educate future generations to prevent abuses from occurring. Repair, we want to healing, an opportunity for healing for those that were directly impacted and are currently being directly impacted. It was really phenomenal last night when Sarita mentioned, and some of the other presenters mentioned, that we're talking about things that are happening today. This is not just the history. And redress, researching lessons from Rikers' longer history and identifying strategies for reinvestment in impacted communities. So why are we doing the work that we're doing? We need to harness the public memory process to shift the criminalizing narratives about the people detained at Rikers. It's important that we lean deeper into the messages about the fundamental human rights of all people, no matter what they've done or what they're being accused of. And this feels particularly urgent right now with the record number of deaths and reported suicides at Rikers in this year alone. So here we see an illustration of a woman with long hair sitting alone in a jail cell. So we want to see Rikers closed forever. So in doing that, we have so far collected and recorded 105 stories. And we have over 72 hours of audio. And these oral stories are of formerly incarcerated people and their loved ones. We have stories from entry to re-entry. And we're particularly responsible about resisting any popular notions of having a balanced story. We wanted to maintain that accountability to the narrators and further emphasize that at every stage that they are co-owners of their own stories. This process required collaboration on many fronts and with many stakeholders. We partnered with local organizations that currently serve formerly and current incarcerated people, with a deliberately establishing connections in neighborhoods where people were most impacted. We had intentional outreach to stakeholders representing affected communities, such as the LGBTQ community and people with disabilities, and had an amazing partnership with Exodus Transitional, where it enabled us to document the experiences of people released from Rikers during the COVID pandemic. We've recruited and trained volunteers, Our interview process in the beginning, we started at local libraries asking people to come to us. We shifted because we found that it was really important that we meet people where they were at. And we were able to do that through the partnership with our local organizations. And once the pandemic hit, we had to move to Zoom interviews. So the last 2 years, we've been activating these stories. We recruited volunteers who helped transcribe the interviews and had opportunities to share space with other volunteers through transcribing parties, where we can support each other through transcribing, as well as learn from the narrators' stories. And we've created a series of podcasts as well as videos to further activate these stories. All of this content is available on our YouTube page. And we're currently working with a design team to create a mobile museum where that's going to be available to the public. And there was a lot of lessons learned, and Murphy will share some of these lessons learned in her presentation. And finally, I want to mention that this Rikers Public Memory Project was developed through a partnership between 3 organizations: Freedom Agenda, Create Forward, and the Humanities Action Lab, who together sought to think through ways that public memory process can be used for strategic organizing. And all of the work of the Rikers Public Memory Project is integrated into the national work of all 3 partners who work to confront past harms from the criminal justice system as part of their struggle for reform. So it's Freedom Agenda, Create Forward, and Humanities Action Lab. So there are a number of ways that you can support our project. You can follow us on Facebook, Twitter, and Instagram, YouTube, and visit us on our website. And without further ado, I would like to hand things over to my co-facilitator, Murphy Carter, from the Texas After Violence Project.
Thank you so much, Regina. Looking at everything that Rikers Public Memory Project has done is just phenomenal. So I really appreciate what a thorough landscape you provided for all of us. I do want to make sure to mention that we have so many things we're trying to get through, but we are within the time constraints we have. So we're going to try and get as much done as we can, but we're always hopeful to continue the conversation. And at the very end of the presentation, we're going to have our email addresses available. So please don't be a stranger. An hour is a short amount of time to try to fit all of this in. But Regina, I think you did a phenomenal job of giving us that beautiful landscape of the work that y'all have been doing in an effort to use narrative strategy to build a vision of abolition. So with that, I'm going to talk a little bit about my role as program coordinator at the Texas After Violence Project. Really quickly, my name is Murphy. My pronouns are she, her. I have long, somewhat wet, wavy hair. I'm wearing gold framed glasses. And behind me are a lot of books and a blue portrait of my family. So really quickly, Texas After Violence Project is a documentary-based project. Actually, could you go to the next slide, please? Thank you. Is a community-based archive and documentary project cultivating deeper understandings of the impacts of state-sanctioned violence. We were founded in 2007, and so a lot of our focus has kind of evolved over time, but we're continually trying to encompass and re-understand what the impacts of state-sanctioned violence are. And so at the beginning, and this is something that my co-conspirator, collaborator, Gabriel Solis discussed last night. He talked quite a bit about how it used to focus on the death penalty, but then over time, we've encompassed more interviews, reaching out to more folks who have been affected by state-sanctioned violence. And our mission is to conduct responsible, inclusive, and ethical research to build an archive of stories that shift narrative power. So the community archive piece is building a public and digital archive of stories and other materials. The projects that I just alluded to that can range from discussing the death penalty to also dealing with police brutality, how these iterations of state-sanctioned violence interconnect, are housed under the umbrella of our Life and Death in the Carceral State project. We also have a project called Access to Treatment, which is about helping to train mental health professionals to better support family members and loved ones who have been directly impacted by state execution, state and federal execution, which is a phenomenal project as well. I wish I could speak more at length about it, but our program coordinator, Susanna Sheffer, has really done amazing things, and I want to make sure to shout her out for anyone who has any interest in that. And then finally on this slide, I have Sheltering Justice. You'll also see on the left-hand side of the slide a portrait of one of our storytellers holding a portrait of her loved one who she lost to state-sanctioned violence. And yeah, next slide, thank you. You anticipated it perfectly. So for the documentation efforts, we're co-creating an archive of survival. This is something that Regina articulated beautifully when we talk about being co-owners with our narrators. We emphasize ongoing consent throughout every stage of our interviewing process as a way to always acknowledge and put first the lived experience, agency, and authority of our narrators to let them know that this is their story. And we are grateful that they are willing to share it in the archive. But if at any point they do not want their story in the archive, they can always, they have creative control of it all. On the right-hand side of this slide, you're actually looking at a submission to the Sheltering Justice Project, which again, I'm about to talk a little bit more about. And this was submitted from someone who is currently incarcerated, and it's entitled COVID and K2 Pandemic. The image itself looks almost to be of a graveyard. There's a cross on the bottom right-hand side, and there's a picture of the moon crying with red tears. It's very harrowing as an image. So what is Sheltering Justice? I've been talking about it. And Sheltering Justice is a project that collects and preserves the voices of those directly and disproportionately impacted at the intersection of COVID-19 and mass incarceration. And this was really an opportunity at the very beginning of the pandemic. My coworkers recognized the urgent need to ensure that we would collect those voices, preserve those voices, and honor their stories, because immediately there's a state-sanctioned narrative as well, right? There's a certain way that COVID-19 was going to be purported in the mainstream conversation. And with that foresight, decided that we needed to make sure to always follow and honor the stories of those directly impacted to make sure we can push against that state-sanctioned narrative. And I want to go to the next slide. Oh, yeah, sorry. I linked everything, so if that was a tricky thing. Thank you. Sorry about that. So just to give you a picture of COVID-19 as it stands in Texas jails and prisons, the numbers are harrowing. The numbers are of the 731,000, almost 732,000 tested, 37,482 people who are incarcerated have tested positive. And then there's also, this is also something that Regina touched upon, the numbers for those who work in these facilities as well. These numbers are surely underreported. There are disparate methods that are used to collect this information, but I would be remiss not to include this information in this presentation because it's essential for how we've been moving forward in this project. And one of our narrators will actually talk a bit more about Texas in particular. So the why behind Sheltering Justice is something that I've already alluded to. If you look at this slide, there's going to be 2 photographs of contributors to our archive. At the bottom is a man talking with his hands as he's also talking into a microphone, and he's wearing a suit and he's looking off in the distance. There's kind of a purple light on him. And he's one of our narrators named David Johnson, who contributed to the Sheltering Justice Archive. Above him is Jorge Renault, who is Texas After Violence Project's writer in residence. And this is him speaking at a poetry reading. He also has a microphone in front of him, and he's standing on a stage looking out at the audience while wearing some blue jeans with his hands in his pocket and wearing glasses. I felt having these two narrators to be included because these are the voices that guide, right? This is the why behind Sheltering Justice, because we wanted to, like I said, responsibly and ethically document, preserve, and share stories, and to conduct virtual oral histories with formerly incarcerated people, people who have already been released as a result of the pandemic, as well as loved ones, activists, advocates, and organizers fighting for the urgent release of those who are currently incarcerated. And we also wanted to learn about how this has affected them, not only if the person is someone who's currently incarcerated and has, tested positive for COVID-19, but how has it affected them if they're currently incarcerated, or if their loved one, is trying to get a hold of them, what the dailiness of their life and how everything has suddenly changed from the isolation, the impossibility of social distancing, etc. And on the right-hand side of this slide, you'll actually see another submission that was given to Sheltering Justice. It's a letter that was included with a mask and soap. And so at the very beginning of the pandemic, this was the only amount of soap, tiny little green bars that are probably like 2 inches by 1 inch each, and flimsy cloth masks. And that was all that folks were given for a week. So that's a really, really important image for our archive as well. Thank you. Thank you. And really quickly, I wanted to kind of peek into the archive and highlight one of our storytellers named Lavina Igbani. And I'm not going to read the entirety of this quote, although it's phenomenal, and I invite you all to, if you can, and listen to Lavina's interview as well. But Lavina was our first interview for Sheltering Justice, and Lavina says, "We keep going, we keep planning." These are bolded sections that I just want to make sure to highlight. Lavina says, "I believe in my heart that as long as we don't give up, we will succeed. We're going to make it happen. And I believe, I just can see it now. We're going to see something happen." And Lavina is a phenomenal interviewee who also, with the onset of the pandemic, became a wonderful and very impactful activist here in Texas as well. And then another kind of selection of our archive, I wanted to make sure to honor that we have 3 sub-collections. One is through Mourning Our Losses, which is an amazing project seeking to document and honor those who lost their lives to COVID-19 while on the inside. The second is and the first is actually from Mourning Our Losses. This image is a portrait of Derek Coley, created by E.J. Joyner, and it is a pencil drawn image of Derek smiling and looking directly at you, which I think is really beautiful. And then the second image is a poem called Justice is a Lie that was submitted to Sheltering Justice via the Inside Books Project archive. And it was created by Albert James Haduo. I hope I'm pronouncing that correctly. And then finally, what I've been alluding to is some of these Zoom interviews that we've been doing for Sheltering Justice. And this is a portrait that one of our interviewees named Anit Dominic, who you will hear from momentarily, submitted to us. And that is from the Sheltering Justice interviews themselves. Sheltering Justice, we have over 26 hours of interview footage conducted over the past 1.5 years. With more than 80 items from folks who are currently incarcerated. So we kind of have it broken up into these big sections of these interviews that we've been conducting mostly by Zoom. And then the ability for folks who are currently incarcerated to send in letters, essays, meal logs, poems, anything that they feel comfortable sharing with to document their experience of the pandemic while incarcerated. And then we also have a Sheltering Justice podcast that we're hoping to build upon even more. That was co-created with Dublab FM, which is an amazing radio station out of Los Angeles. And then a little bit about the how. This is something that Regina talked a bit about too, which is the process of collecting interviews and materials during a pandemic and the unique set of challenges and opportunities that it provides. So a little bit about how we conduct outreach, I'll talk more about on the next slide, because I think that that's a huge piece of the lessons learned behind these projects. the pre-interview process and knowing that talking with someone as much as you can to create that safe relationship, cultivate a keen understanding and trust between one another was always vital and has always been a part of our process, but felt equally important in these moments where from one day to the next, you don't know what's going to be happening and what's going on. And then interviewing online became a huge piece of sheltering justice. How Zoom literate can you get? How quickly can you do it? But there are serious questions of accessibility behind it as well. And then we had the post-interview process to make sure that we're always emphasizing and maintaining those relationships with our interviewees. I supplied an image on the right-hand side of this slide, and it is actually of my computer interviewing Lavina Igbani, our storyteller who I quoted earlier, to kind of give you a glimpse of how this process looks now and just how different it has been this past year compared to when you were interviewing in person. So there's a picture of Lavina's face. And then, thank you. So the lessons learned, I'm going to try and go through this quickly, but please feel free to ask questions about it as well. So trying to really consider accessibility, always knowing that Zoom creates certain challenges, right? For those who maybe aren't as able to have a connection to internet. There are certain environmental, incidental accessibility concerns. And if you're somebody who's been recently released, are you going to have a computer? Maybe having a flip phone is something easier. So those are accessibility questions that we're constantly interrogating and trying to figure out ways to make sure that every story that wants to be shared has an opportunity to be shared. And again, refusing the idea that there has to be a balanced narrative, that this archive is trying to host every story and collect every voice that again feels hopeful and willing to share. And then the lessons learned, support and post-interview process are two columns in the slide that really feed into each other. And bottom line for this is about cultivating these relationships over time. One thing that I'm really proud of for Sheltering Justice is we've been able to provide an opportunity for longitudinal interviewing as well. So we have follow-up interviews, which I think very early stage pandemic Murphy would have been shocked by. But now we're still in contact with folks. The situation, again, is always changing. And so we're trying to make sure that we provide support, that we are clear about our post-interview process, and that throughout our process of ongoing consent, we're also doing what we can to clarify and work with our narrators at every single stage of the interview process. And then finally is something that was spoken about at length last night, which is, where do these stories go? What do we do with them? And I'm really focused and work with my collaborators about shifting power and engaging in ways to safely share our stories with those who have already contributed. How do we make sure that folks who are incarcerated know that their stories are being shared and giving them an opportunity to see, what's going on, but also putting these materials in the hands of people who are on the ground, building movements and creating direct action, city council members, activists, journalists, and making sure that these stories have the full impact that their content and their gravity already carry. So, and here's a way to get in touch and how to support Sheltering Justice: Facebook, Twitter, Instagram. There's also an email here that you should feel free to reach out to. And we have 3 websites, which I recognize may be a little confusing at first to see, but we have our Texas After Violence Project, our website, and then the Sheltering Justice website. That middle website is called the After Violence Archive, which I'm so proud to say has gone live, and that is the official hub for all of our interviews as well. And it's really phenomenal. My coworker Jane Field has done a phenomenal job with it. All right, and let's hear from the narrators themselves. This is Casey Phillips, who is formerly the president of the Texas Air Conditioning Advocates, and her husband is currently incarcerated.
TDCJ come up with these little stickers that they were placing on people's sick call requests that said due to COVID, they were not going to be seeing them because it wasn't considered an emergency, and that basically what they were trying to say was, we're putting you on hold. Not that we're denying you access to care, but we're putting you on hold. But the way everyone read it was, they're denying me healthcare because I'm asking for healthcare now and I'm not getting it. So that's been a big issue and it's still an ongoing problem. But far as him, now they wanted him to go to his specialist because he has a specialist at the unit for his renal specialist. But for all year, he's just finally went a few weeks ago, but he was denying and refusing to go to those appointments because he would have to have gotten in a van with other people. They refused to give him gloves. He would only have a mask. They didn't clean the vans like they said they were. So he would refuse to go because he was terrified of getting COVID. He actually got COVID. He tested positive for COVID at the beginning of August. So he was scared to get it again. He had mild symptoms, but that didn't mean if he got it again, he'd have mild symptoms. So he would refuse to go all year until here recently he went, and it was like pointless to go because they didn't do anything for him. So said, see you in a month. So, I mean, it wasn't like they were really helpful, but yeah, it's still, healthcare is a big problem. It's a really big problem.
So there was no tending to or help for the experience of swelling or any.
That the provider actually told him that he would not renew his one of his medications, his water pills is what we call them, his water pills. He wouldn't renew them until he came to see him. So he had no choice but to go see him because he wouldn't give him that medication. So he's like holding the medication hostage until he saw him. But then he didn't say anything about the issue. So it was kind of like a pointless visit. And his levels, like his creatinine levels and his GFR, and the main two things that they look at before you have to go on dialysis, he didn't even acknowledge them. And they're not good numbers, but he didn't even acknowledge them. So, I mean, healthcare is always going to be a problem in there. And if they're extremely sick, they need to be let out. They need to be let out so they can get proper care. TDCJ come.
And then Regina, do you want to go to the next one? Just because of time.
In the middle of the heat, now we have like.
I guess in March, I was supposed to go to court, and this is when I guess the whole COVID thing got crazy. What they did was they just stopped all movement. They locked us in our dorm, 50 girls in one dorm, and it came to the point that the officers weren't even coming inside on the floor, that they were basically just staying in the bubble, which made us feel real uncomfortable. Like basically, I mean, we were watching the news and everything, but we didn't know how serious it was until one of our steady officers was crying and wouldn't come inside. And it actually caused like a big riot. Like people were, they grabbed our officer's phone. They were trying to break the glass, because it made us feel like you're just locking us in a room. And from 50 girls, every day they would take maybe 5 or 6 girls away because I guess they had symptoms. They started basically taking everyone's temperatures every day. And I was one of the lucky ones. I mean, out of 50 girls, I think 12 of us were left that didn't have any symptoms. But, to be basically just stuck in a room for months with no movement, nothing, it was kind of, got to me. I guess in March, I was supposed to.
I was working food service. You want me to deliver food to these guys. You want me to hand out the food to these guys. You don't want to touch it. You don't want to touch them. You don't want to go near them. So you send us in like crash dummies. They didn't have the mask. They didn't have anything. So we were ripping sheets. We were tearing up sheets and making our own face masks. We looked like a bunch of bandits running around. All you could see was the eyes. That was the only thing we had. And then we see these guys coming in all masked up and shields on their face, but yet we didn't have anything. So we had to makeshift our own stuff. There was no sanitizer, no hand sanitizer. They came in with some stuff after about maybe 4 weeks, a spray bottle to spray down handles and doorknobs and toilet seats. But it was like once a day. Like, what do you do the rest of the day? This guy's sitting on those toilets constantly. This guy's showering those showers constantly. What are you doing about that? You know, the garbage is piling up to the point where they said they don't have any more garbage bags. Garbage just breeds germs. Like, what are we doing about that? You know, nothing. I've been on Rikers Island for different spells. 6 months, 3 months, 1 year. I've been there quite a few times, but this happened to be the worst time. Even the officers, to the point where they're saying, I don't even want to come to work. Like, I'm going to use my sick time. This is what I'm going to do. You know, and yeah, they talk to you. Say, look, man, I know what I'm doing. I'm not going to stay here. I got 3 months sick time. I'm going to take that right now. We can't do that. We can't say, yo, here we go. Can we go now? We'll be back in 3 months. Like I said, this is the worst I've ever seen Rikers Island. I could say my 20-year experience going back and forth.
So these last two narrators that you heard from were from the Rikers Public Memory Project interviews that were collected last summer. And both Lauren Valente and Stanley Morris were incarcerated in early 2020 when COVID-19 first swept through the facility. And we were able to create these by looking at and listening to the oral stories that were collected, and our grad assistant, Annie Anderson, helped create these little mini podcasts to be able to share and highlight what's been going on at Rikers Island during the pandemic. Murphy?
Oh, sorry. Yeah. Okay. So looking at this, we have a Slido. If you have your cell phone nearby, you can use this QR code. I am going to put also this question in the chat just so everyone can also look at it in case when you're pulling this up on your phone, you need another reference. But we wanted to go ahead and open it up and have a moment for y'all to reflect. Again, this is just going to be for a moment or two, but having listened to multiple narrators and excerpts of their interviews, what do you notice about each narrator's experience of conditions of confinement with COVID and/or healthcare? Again, I know it's only a moment or two, but I wanted to make sure that we can all hear from you. So lack of information. Thank you for starting us off. And if you have any tech issues, please let us know. Thank you so much, y'all. All right, and so the question that I put in the chat is actually this question because it's not really a presentation or a webinar unless you hiccup, you know? So this is a question that I want to invite everyone to take a few more minutes with. We'll give more time for this question, but we want to get at the underpinning of this entire presentation, which is how has the pandemic further revealed how deeply entrenched health inequities are in systems of confinement. And I think a lot of the reflections that y'all are having of the narratives themselves dovetail really beautifully in terms of how we make sense of this question. So as y'all are thinking about this, again, you can use your phone to use the QR code and answer this question. How has the pandemic further revealed these deeply entrenched health inequities in systems of confinement? All right, so thank you all for sharing some of your reactions and what you're seeing. And there's obviously a lot of overlap between even some of these responses for this poll. And I think something that, you know, the narrators, whether they're discussing carceral space in Texas or Rikers Island, touch on so many of these ways in which the health inequities are clearly present and just built into the architecture and into the planning of something like a jail or a prison or a detention center. So I want to make sure to acknowledge that, and also thank you all. I'd never done a Slido before, so y'all are doing great. And yeah, finally, I want to say thank you to the Laundromat Project, and thank you to Regina. And also thank you to Piper and to Kemi and to Hatui for organizing all of this. It's been truly amazing. I really want to reiterate that Regina and I both would love for you to contact us if you have any questions. We shared a lot of really textured and nuanced and essential information in this presentation. And so we always want to keep the conversation going, and we look forward to hearing from you. And Regina, is there anything else that you would like to add?
No, I do want to thank everyone for being present this morning and encourage everyone to continue to be a part of this conversation and to participate in the rest of the sessions for today.
Thank you. Huge thank you to Murphy and Regina. That was incredible. A reminder of the power of stories in the history of humanity, and particularly for folks of color and folks who are in times of crisis and resistance, right? So the power of organizing and the power of resisting was also embedded in a lot of what you shared. Thanks so much. Thank you to our supporters for making this program possible. An incredible thank you to Piper for putting this together and making yesterday and today possible. The LP team has been working on this for a number of months. So thank you so much, Atwe, Tiara, Emma, and everyone else, for your time, your thought, your care, your consideration in all parts of putting this together for today. Thank you all who joined us and made time in your day for this, to learn, to gather, to be enraged, and to be inspired. Thank you so much. I hope you will take some of what you've heard and learned back to your own communities, your own care circles, so that we can work collectively to draw a much more just future, one that is filled with the stories that we do want to hear, that hopefully will bring happy tears. We'll be sharing the recording and transcript of this conversation shortly on our channels, particularly our YouTube channel. I hope you'll join us for the rest of our remaining 3 sessions today. The one happening in an hour is Piper Anderson herself, teaching us about aftercare, which came up in the conversation yesterday. How do we do that as well? Care for ourselves while dealing with material and lives and concerns that are harrowing. So really, we hope that you'll join us either live today or look at the video documentation later. And we invite you to follow and stay up to date with each of the organizations and projects you learned of today, in this session, yesterday, and going forward. But also for the LP and Create Forward, which is Piper's entity. We're on all the various platforms, and I believe some of that information will also be dropped into the chat. Thank you. Have a grace-filled day.